Humble nurse saves arrogant doctor's life with shocking move. Dr. Michael Williams strode down the hallway of Mercy General Hospital with his usual haughty demeanor, ignoring the greetings from staff members who crossed his path. At 42, he was considered one of Chicago's most respected cardiologists, but his arrogance was well known among the team. That's when a sharp pain sliced through his chest like a blade. The doctor stopped abruptly, clutching his chest as cold sweat dripped down his forehead. His glasses fogged as he struggled to breathe, but air refused to reach his lungs. "Dr. Williams!" someone shouted behind him. But he couldn't turn. His legs gave way, and his body collapsed onto the cold hallway floor. His white coat splayed around him like broken wings. The sound of the impact echoed off the walls, sending nurses and technicians rushing toward him. "Call for help! It's Dr. Williams!" a distant voice cried out. Amanda Johnson, 28, was organizing medications at the nursing station when she heard the commotion. She immediately recognized the panic in the voice and felt her heart race. Just 2 hours earlier, Dr. Williams had humiliated her in front of colleagues. "A mere technician like you shouldn't be giving opinions on diagnoses," were his exact words when she suggested additional tests for a patient. The memory still stung, but her professional instincts took over. Amanda dropped the medications and ran down the hall, her white sneakers squeaking against the floor. When she arrived, she found Dr. Williams on the ground, surrounded by frantic colleagues. His face was pale, lips slightly blue, and he was gasping for air. "Has anyone called emergency services?" asked Dr. Anderson, head of cardiology, kneeling beside his colleague. "They're on their way," a nurse replied. Amanda stepped closer, carefully observing his symptoms. Something wasn't right. She noticed his pupils were unevenly dilated, one larger than the other. There was also an unusual stiffness in his neck that didn't match a typical heart attack. "Dr. Anderson," she said, but was ignored. "Prepare the defibrillator," Dr. Anderson ordered. "This looks like myocardial infarction." "No!" Amanda shouted, startling everyone. "Please don't touch him yet." All eyes turned to her in disbelief. Dr. Anderson glared at her impatiently. "Amanda, please, let the doctors handle this," he said condescendingly. "Doctor, with all due respect, look at his pupils. They're uneven, and see the stiffness in his neck. This isn't a heart attack," she insisted, kneeling beside Dr. Williams. Dear listener, if you're enjoying this story, don't forget to like and subscribe to the channel. It really helps us newcomers grow. Now back to the story. Dr. Anderson shook his head. "Amanda, you're an excellent technician, but this is a medical matter. The protocol for heart attacks is clear. Doctor, I saw him secretly taking pills in the bathroom months ago," she revealed, causing a tense silence. "Whenever no one was looking. This could be a severe allergic reaction to medication." The revelation hit like a bombshell. Dr. Anderson hesitated, glancing between Amanda and his unconscious colleague. "That's impossible. Williams never mentioned taking medication," Dr. Anderson muttered. "I know what I saw," Amanda insisted. "And these symptoms, the uneven pupils, neck stiffness, the specific breathing difficulty, it all points to drug toxicity, not a heart attack." At that moment, the emergency team arrived with the crash cart. The emergency medical technician began preparing the equipment for cardiac resuscitation. "Let's follow the standard protocol," said the technician. "Wait." Amanda stood up quickly. "Please, give me 2 minutes to check something before administering any cardiac medication. If I'm right, the heart attack medication could drastically worsen his condition." Dr. Anderson looked at her with an expression torn between irritation and curiosity. "Amanda, you're asking us to bet a colleague's life on your intuition." "I'm asking for 2 minutes to save his life," she replied firmly. Dr. Michael Williams's heartbeats were irregular on the monitor, but didn't show the typical pattern of a heart attack. Amanda pointed to the screen. "Look at the rhythm. It's not the arrhythmia characteristic of an acute heart attack, it's more consistent with poisoning." An older nurse, Nurse Betty, who had worked at the hospital for over 30 years, stepped forward. "Amanda is right about one thing," Betty said. "I've also seen Dr. Williams going to the bathroom suspiciously often these past few months, always with a nervous look. Just then, Dr. Williams's wife, Jennifer, came running down the hallway. She had been called by the hospital secretary after the incident. "My God, what happened to my husband?" she cried, seeing him unconscious on the floor. "Mrs. Jennifer, please stay calm," said Dr. Anderson. "We're taking care of him." Jennifer knelt beside her husband, clutching his cold hand. "Do something. Follow the medical protocol, she begged, then glanced at Amanda with suspicion. "Why is this nurse giving orders? You're the doctors." "Mrs. Jennifer," Amanda spoke to her gently, "I believe your husband may be having an adverse reaction to some medication he was taking without a prescription. That's ridiculous. Michael would never take medication without telling me," Jennifer replied, but there was hesitation in her voice. Dr. Anderson looked at the monitor again. Dr. Williams's vitals were deteriorating rapidly, but the pattern didn't match a typical heart attack. "Amanda," he finally said, "you have 90 seconds. If you can't prove your theory, we're following the cardiac protocol immediately." Amanda nodded and ran toward Dr. Williams's office. Her hands shook as she searched for the key she knew he kept above the doorframe, a habit she'd noticed over her years working at the hospital. Inside the office, she went straight to his personal cabinet. There, hidden behind medical books, she found 2 medication bottles. Her eyes widened as she read the labels, Xanax and Luvox, both with handwritten dosage changes. "Anxiety and depression meds," she murmured to herself, "and very high doses." Amanda grabbed the bottles and ran back to the hallway. When she showed them to Dr. Anderson, his face paled. "My God," he whispered, "he was self-medicating for anxiety. And look at the doses." Amanda pointed to the handwritten adjustments. "He increased them on his own. The interaction between these two, especially in high doses, can cause exactly the symptoms we're seeing." Jennifer took one of the bottles with trembling hands. I didn't know," she stammered. "Michael had been acting strange these past months, more nervous, but he always said everything was fine." At that moment, Kevin Williams, Dr. Williams's son and a newly graduated doctor, arrived at the hospital after getting his mother's call. When he saw the medications, his face twisted in recognition. "Dad was taking anxiety meds?" he asked, disbelieving. "Kevin," Amanda addressed him, "can you confirm the symptoms? Asymmetrically dilated pupils, neck stiffness, atypical arrhythmia?" Kevin quickly examined his father and nodded gravely. "Acute drug intoxication," he agreed. "The nurse is right." Dr. Anderson finally made the decision. "Let's try the protocol for benzodiazepine and antidepressant overdose reversal," he ordered. "Prepare Romazicon to start." The emergency team swiftly switched protocols. Amanda monitored every move, mentally calculating dosages based on her experience and the studies she did in her free time. The first dose of Romazicon was administered, but Dr. Michael showed no immediate improvement. The minutes dragged like hours as everyone watched the heart monitor. "It's not working," Jennifer murmured, tears in her eyes. "The overdose might be more severe than we thought," Dr. Anderson said, beginning to doubt his decision. Amanda recalled a conversation she had overheard accidentally 2 weeks earlier, when Dr. Michael was on the phone with a colleague about adjusting the doses because the effect wasn't strong enough. "Dr. Anderson," she said urgently, "I believe he was taking much higher doses than prescribed. We need to increase the antidote dosage." "That's too risky, Amanda," Dr. Anderson replied. "A Romazicon overdose can cause seizures." "But if we don't try, he could slip into irreversible coma," she insisted. Kevin looked at his father, then at Amanda. "I trust her judgment," he said. "Double the dose." Against all standard orders and protocols, Dr. Anderson authorized a higher dose of Romazicon. The hospital director, Dr. Robert Thompson, had arrived and watched the scene with a tense expression. "If anything goes wrong, all of you will be held accountable," he warned. Amanda held Dr. Michael's hand firmly as the second dose was administered. She whispered a silent prayer, thinking of all the times he had disrespected her, but also of her duty as a healthcare professional. Suddenly, Dr. Michael began convulsing. His body writhed on the floor, and Jennifer cried out in despair. "You've killed him!" she shouted, glaring accusingly at Amanda. "No!" Amanda held Dr. Michael's head steady. protecting him from injury. "This is normal. The seizure means the antidote is working. His brain is reacting to the overdose reversal." Dr. Anderson hesitated, but Amanda kept explaining as she kept Dr. Michael safe during the seizure. In cases of severe benzodiazepine overdose, when romazicon reverses the effect, there can be a temporary phase of neuronal hyperactivity. It's a positive sign. The seizure lasted about 30 seconds, an eternity for everyone present. When it finally stopped, Dr. Michael slowly opened his eyes, blinking in confusion. "What? Where am I?" he murmured weakly. Jennifer knelt beside him, crying in relief. "Michael, you're in the hospital. You collapsed in the hallway." Dr. Michael tried to sit up, but Amanda helped him stay lying down. "Doctor, please stay calm. You had a severe adverse reaction to the medication you were taking," she explained gently. Dr. Michael's eyes focused on Amanda, and for a moment, confusion flickered across his face. You saved me?" he asked faintly. Amanda nodded, still holding his wrist to monitor his pulse. "Doctor, we need to talk about the medication we found in your office," Dr. Anderson said, his tone serious but understanding. Dr. Michael's face twisted with shame and fear. "How did you find out?" he whispered. "Nurse Amanda noticed your symptoms and made the connection," replied Kevin, looking at his father with a mix of concern and disappointment. Dr. Michael looked at Amanda with tear-filled eyes. I couldn't take it anymore," he confessed, "after what happened to that girl." "What girl, Dad?" Kevin asked. "The 12-year-old girl. Emily Parker. She had a complex congenital heart condition," Dr. Michael began, his voice trembling. "I operated on her 2 years ago. Everything seemed to go well, but she had post-op complications and she passed away." Jennifer took her husband's hand, surprised by the revelation. "Michael, you never told me this," she said softly. "I couldn't talk about it with anyone," he continued. "Her family didn't blame me, but I knew I could have done something differently. I started having panic attacks before surgeries. I couldn't sleep. That's when I began taking the anxiety meds." Amanda felt a pang in her chest. She remembered the case he mentioned. Emily Parker was Tyler's sister, a boy who worked at the hospital doing odd jobs to support his family after losing his sister. "Doctor," Amanda said gently, "I know the Parker family. Tyler works here at the hospital. He's never spoken badly of you. On the contrary, he always says you did everything you could to save his sister." Dr. Michael looked at her in surprise. "You know Tyler?" "Yes, and I can assure you he holds no resentment. In fact, he always says he wants to be a doctor to help other kids like his sister. He admires you, Doctor." Tears streamed down Dr. Michael's face. I didn't know. I thought he hated me. Every time I saw him in the halls, I felt terrible guilt." Dear listener, if you're enjoying the story, please take a moment to like and especially subscribe to the channel. It helps us a lot as we're just starting out. Now, back to the story. Dr. Robert, the director, approached the group. "Doctor, Michael, we need to talk about your condition and how it affects your medical practice," he said seriously. "I know," Dr. Michael replied. "I should have sought professional help a long time ago. My pride and shame nearly cost me my life." Amanda stood to give the family space, but Dr. Michael held her arm. "Amanda, thank you," he said, looking into her eyes. "If you hadn't insisted, I wouldn't be here. After how I treated you today." "Doctor, it's my job," she replied simply. "To care for people no matter what." "No, it's more than that," he insisted. "You showed me compassion when I didn't deserve it, and you showed knowledge I completely underestimated." At that moment, Nurse Betty stepped forward. "Amanda, can I say something?" she asked. "Dr. Michael, Amanda has been studying medicine at night for 5 years. She had to stop last year due to financial difficulties, but she knows as much as many licensed doctors." Dr. Michael looked at Amanda with even greater surprise. "You're studying medicine? Why did you stop?" Amanda hesitated, uncomfortable with the attention. "My mother got sick, and I had to work more hours to help with treatment costs," she explained. I had to choose between continuing my studies or taking care of her. What kind of illness? Kevin asked, interested. Breast cancer. She's in remission now, thank God, but the treatment was long and expensive. Dr. Michael tried to sit up again, this time more successfully. Amanda, how did you recognize the drug toxicity? He asked. After my brother had a severe adverse reaction to medication years ago, I started obsessively studying drug interactions, she explained. I wanted to understand what happened to him, so it would never happen to anyone in my family again. Your brother? Jennifer asked with interest. He had an anaphylactic reaction to an antibiotic that was prescribed incorrectly. We almost lost him. That's when I realized how important it is to fully understand the medications we administer. Dr. Michael Williams shook his head, clearly impressed. And I treated you like you were just a clueless technician, he said, ashamed. How many times has this happened? How many other valuable observations have I ignored because of my ego? Dr. Anderson joined the conversation. Michael, we've all made that mistake. Medicine isn't a hierarchy where only doctors can have valuable insights. It's a team. Dad, Kevin said, why did you never seek professional help to deal with the guilt? Dr. Michael sighed deeply. Pride, fear. I thought if anyone knew I was struggling psychologically, they'd question my competence as a surgeon. So I started self-medicating, increasing the doses when the effect wore off. But that only made things worse, Jennifer observed. You became more irritable, more distant. I knew something was wrong, but I didn't know how to bring it up. Amanda listened to the conversation in silence, but a memory troubled her. There was something else she had noticed about Dr. Michael in recent months, something she hadn't mentioned yet. Dr. Michael, she said hesitantly, can I ask you a personal question? Of course, Amanda. After what you did for me, you can ask anything. I noticed that besides the anxiety meds, you were also taking something for sleep, because sometimes your eyes had that drowsy look. Dr. Michael glanced at his wife and then at his son before answering. Yes, he admitted. Ambien, for insomnia, also on my own. Dr. Anderson looked alarmed. Michael, were you mixing 3 different types of psychotropic medication? That's extremely dangerous. I know that now, Dr. Michael replied, but back then, I just wanted the psychological pain to stop. I wanted to sleep. I wanted to operate without panic attacks. Amanda felt a chill in her stomach. The triple combination of medications explained why the symptoms had been so severe. Dr. Anderson, she said urgently, if he was taking 3 different medications, there could be an even more complex interaction. We need to monitor him longer. As if the universe were confirming her fears, Dr. Michael suddenly writhed in pain again. My chest. It hurts again, he groaned. The heart monitor began beeping rapidly. His heart rate was rising dangerously. It's a rebound reaction, Amanda said quickly. When the Romazicon starts leaving the system, the original medications can take effect again. Dr. Anderson rushed to check the vitals. She's right. We need another dose, but this time as a continuous infusion. I don't know if my heart can handle another dose, Dr. Michael said weakly. It can, Amanda said, taking his hand again. But we need to do this more carefully now that we know about the 3rd medication. Kevin looked at Amanda with admiration. How did you learn so much about drug toxicity? Necessity, she replied simply. When someone you love almost loses their life to a medical error, you study everything you can to never feel powerless again. Dr. Robert, who had been silently observing, stepped forward. Amanda, where did you study medicine? At Chicago Metropolitan University at night. I got a partial scholarship, but it was still too expensive to keep up. And your professors? What were your grades like? Amanda felt awkward at the question, but answered honestly. I was always one of the top in my class. My professors said I had a talent for differential diagnosis. Doctor. Michael heard this and looked at Dr. Robert. Robert, I have an idea, he said, still lying down but with a firmer voice. What if we offered her a full scholarship to finish her degree? Amanda looked at him in surprise. Doctor, I can't accept that. It would be charity and It's not charity, Dr. Michael interrupted. It's recognizing talent. And it's also my way of making up for underestimating you and probably many other professionals throughout my career. Jennifer joined the conversation. Michael, that's an excellent idea. The hospital could benefit from having doctors who started as technicians. They understand hospital practice in ways traditional doctors sometimes don't. Dr. Anderson nodded. I've seen Amanda in action many times. She has excellent diagnostic instincts. It would be a huge loss to medicine if she didn't complete her studies. Amanda felt tears in her eyes. I don't know what to say, she murmured. Say yes, Dr. Michael insisted. And also agree to be my mentor in humility. Clearly, I need to learn to value my team more. Kevin smiled at his father. Dad, I think this experience changed you. It really did, Dr. Michael confirmed. Amanda saved me physically, but she also saved me from becoming an even worse doctor. She showed me that competence isn't about titles or diplomas on the wall. At that moment, Tyler Parker appeared in the hallway, pushing a cleaning cart. When he saw the commotion around Dr. Michael, he approached worriedly. What happened to the doctor? He asked Amanda. He wasn't feeling well, Tyler, but he's better now, she replied. Dr. Michael looked at the young man and felt his heart tighten. Tyler, he called, come here, please. The boy approached hesitantly. Yes, doctor? Tyler, I need to apologize, Dr. Michael said, his voice breaking, for not being able to save your sister, for not talking to you about it. I know you must hate me and... Doctor, Tyler gently interrupted, I never hated you. My sister was very sick. You did everything you could. My mother always told me that. Dr. Michael began to cry. But she was so young. She had her whole life ahead of her. Yes, she did, Tyler agreed. But because of you, she had a few more months with us. Months where she could play, laugh, teach me things. Those months were precious. Tyler, Amanda joined in, tell Dr. Michael about your plans to study medicine. Tyler smiled shyly. It's true, doctor. I want to be a pediatrician, like you, to help other kids like my sister. Dr. Michael looked at the young man with renewed admiration. Tyler, are you already 17? I will be next month, doctor. And have you finished high school? I'll finish this year. I study at night, just like Nurse Amanda did with medicine. Dr. Michael looked at Dr. Robert. Robert, I have another proposal. How about we also offer Tyler a scholarship? We could create a training program for talented young people from low-income families. Dr. Robert considered the idea. That's an interesting proposal, Michael. We can talk to the administration about it. Tyler looked between Dr. Michael and Dr. Robert in disbelief. Are you serious? I could really study medicine? Tyler, Doctor, Michael said, you have the right motivation to be a doctor. You want to help people. That's more important than any technical knowledge, because technique can be learned, but compassion comes from within. Dear listener, if you're enjoying the story, don't forget to like and especially subscribe to the channel. It really helps us who are just starting out. Now, continuing. 2 weeks later, Dr. Michael was in his office with Dr. Henrique, discussing his gradual return to work. He had undergone a complete psychological evaluation and started proper psychiatric follow-up. How are you feeling, Michael? Asked Dr. Anderson. Better, he answered honestly. The psychiatrist adjusted my medication properly, and therapy is helping me process the guilt about Emily in a healthier way. And what about your co-workers? I'm learning to see the team in a completely different way, Dr. Williams admitted. Just yesterday, a nursing assistant pointed out something about a patient that I had completely missed. That's good. Medicine truly is a team effort. At that moment, Amanda knocked on the door. Dr. Williams, may I speak with you? Of course, Amanda, come in. She entered with a paper in her hand and a joyful expression. Doctor, I got confirmation about the scholarship. I can return to college next semester, she said, beaming. That's wonderful. Dr. Williams stood up and congratulated her. You deserve this and so much more. Doctor, I wanted to ask, would you really be willing to mentor me for the rest of my studies? It would be an honor, Amanda, but I think I'm the one who should be learning from you. You've taught me more about compassionate medicine in one day than I learned in years of practice. Dr. Anderson smiled. "Michael, you've really changed." "I had to," he replied. "I nearly lost my life to pride and arrogance. And I almost missed the chance to truly know the amazing people who work beside me every day." Amanda sat in the chair across from his desk. "Doctor, I have an idea for a joint project," she said. "What kind of project?" "A hospital protocol for early identification of drug toxicity. Based on what happened to you, I realized many professionals might not be prepared to recognize the symptoms, especially when multiple medications are involved." Dr. Williams was immediately intrigued. "Go on." "We could create training for the entire staff, from doctors to assistants, about warning signs of self-medication and dangerous interactions. And also an empathetic approach for colleagues who might be struggling with psychological difficulties." Dr. Anderson lit up at the idea. "That's brilliant. How many healthcare workers suffer in silence because they're afraid to seek help?" "Exactly," Amanda agreed. "And how many patients could be saved if everyone on the team felt comfortable speaking up, no matter their position?" Dr. Williams nodded firmly. "Let's develop this together, and I want your name listed as co-author of the protocol." "Doctor, I'm still a student." "Amanda," he interrupted, "you saved my life with knowledge and intuition. I don't care about your current title. You're a complete healthcare professional." 3 months later, Mercy General Hospital implemented the Amanda Michael Protocol, as it became informally known among the staff. The protocol included regular training on identifying drug toxicity and created a more open environment for discussing mental health struggles among professionals. Dr. Williams returned to his surgical duties, but with a completely different approach. He began every team meeting by asking if anyone had observations or concerns, regardless of their role. One Tuesday morning, as he prepared for a complex heart surgery, Amanda, now in her final year of college, approached him. "Dr. Williams, may I share an observation about the patient in room 3? "Always, Amanda. What did you notice?" "The pre-op tests show slightly elevated troponin levels, though still within the normal range. However, while talking with the family, I discovered the patient had experienced a chest pain episode 2 weeks ago that he hadn't mentioned during the examination." Dr. Michael stopped what he was doing immediately. "Do you think it could have been an undiagnosed minor heart attack?" "It's possible. Maybe it's worth repeating the test and doing an additional echocardiogram before surgery." "Excellent observation," he said. "Let's investigate this before proceeding." The additional tests confirmed the patient had suffered a minor heart attack 2 weeks prior. The surgery was postponed to allow for better stabilization, potentially saving the patient's life. "Amanda," Dr. Michael said after receiving the results, "you just prevented a surgical disaster once again." "It was teamwork, Doctor. The family trusted me enough to share details they might not have mentioned to a physician." "And why do you think that happened?" Amanda thought for a moment. "I think sometimes people feel more comfortable talking to someone they perceive as closer to their reality. A nurse they know also comes from a humble background who understands their financial worries about being in the hospital." "That makes me think," Dr. Michael said. "Maybe we should include this in our protocol too, the importance of socioeconomic diversity in the medical team for better patient care." As they spoke, Tyler appeared in the hallway. Now 18, he had started medical school with the scholarship the hospital offered. "Dr. Michael! Amanda!" he called out, beaming. "I aced my first anatomy exam with the highest grade." "Congratulations, Tyler," Amanda greeted him with a hug. "I knew you could do it," Dr. Michael said, smiling. "How are classes?" "Tough, but exciting. And guess what? The professors always use the protocol you developed as an example of collaborative medicine." Dr. Michael and Amanda exchanged satisfied glances. "Tyler," Dr. Michael said, "can I tell you a secret?" "Of course, Doctor." "Your sister Emily didn't pass in vain. The love you have for her, your determination to honor her memory by becoming a doctor, it inspired changes that have already saved many lives, including mine." Tyler felt tears in his eyes. "Doctor, thank you for saying that. Sometimes I talk to her at night, tell her about my studies. I'm sure she'd be proud." "I'm certain she would," Amanda agreed. "And she'd be proud to know the pain of losing her brought so much good into the world." 6 months later, Amanda was graduating from medical school. The graduation ceremony was held in the university auditorium with her entire family present. Her mother, now fully recovered from cancer, wept with emotion in the front row. When it was time for speeches, the guest speaker was announced, Dr. Michael Williams. "Dear graduates," he began, "you are becoming doctors at a time when medicine is rediscovering its human essence. Let me tell you the story of how a nurse saved my life, not just physically, but as a professional and as a person." He recounted the entire story, from his initial arrogance to the moment he nearly lost his life due to self-medication, and how Amanda not only saved him, but completely transformed his perspective on teamwork in medicine. "Amanda Johnson," he said, looking directly at her in the audience, "taught me that competence isn't in the diplomas on our walls, but in our ability to observe, listen, and empathize. She taught me that medicine is a collaborative profession where every team member can offer valuable insights. Today, I'm proud to say Amanda isn't just my former student, but my co-author on a protocol that has already saved dozens of lives in our hospital. And most importantly, she is someone who taught me to be a better doctor and a better human being." When Amanda received her diploma, Dr. Michael was in the audience giving a standing ovation, along with the entire team from Mercy General Hospital who had attended the ceremony. After graduation, there was a small celebration at the hospital. Tyler, now in his second year of medical school, was there, as was the entire team who had been part of the day Dr. Michael almost lost his life. Amanda, Jennifer, Dr. Michael's wife, approached her. "I wanted to thank you personally. You didn't just save my husband, you gave me back the man I fell in love with 20 years ago. He's kind, thoughtful, and humble again." "Jennifer, that was always inside him," Amanda replied. "He just needed to allow himself to be vulnerable." Kevin, Dr. Michael's son, joined the conversation. "Amanda, my dad has completely changed how he works. Now he asks for input from everyone, from the resident doctors to the cleaning staff, and he's discovered incredible insights in the process." "That's wonderful," Amanda smiled. "Medicine should always be like this." Dr. Anderson walked up to the group. "Amanda, I have a proposal for you," he said. "How about doing your residency in cardiology here at the hospital with a specialization in cardiac emergencies?" "It would be a dream," she answered. "But I'd like to keep working on early identification protocols and collaborative medicine." "Perfect," Dr. Anderson said, "because I want you to lead a new department we're creating, integrative medicine and safety protocols." Dr. Michael stepped closer, listening in. "Amanda deserves this and so much more," he said. "She didn't just change my life, she transformed the entire culture of this hospital." At that moment, Dr. Robert, the director, joined the group. "Speaking of transformations, I have news," he announced. "The protocol you two developed is being adopted by other hospitals in our network, and there's interest from hospitals in other states to implement it too." Amanda looked at Dr. Michael in surprise. "Doctor, does this mean our experience could help people across the country?" "Yes, Amanda. Your courage to challenge outdated medical hierarchies and your technical expertise are changing American medicine." Tyler stepped forward, listening. "Amanda, Dr. Michael, did you know there are already 3 nurses from other hospitals who secured scholarships to finish medical school after their supervisors heard our story?" "Really?" Amanda was moved. "Yes," Tyler confirmed. "And one of the hospitals created a permanent program to encourage continuing education for their entire nursing staff." "Doctor," Michael shook his head in admiration. "Amanda, you've started a quiet revolution in medicine." "We did," she corrected him. "Your humility in admitting you were wrong and changing was just as important as any technical knowledge." Nurse Betty, the veteran nurse, approached with a celebration cake. "Amanda, dear," she said, "in 30 years at this hospital, I've never seen a transformation like this. The doctors actually listen to our team now." "Nurse Betty, you've always been respected here," Amanda replied. "Respected, maybe, but not heard the same way. Now, when I suggest something, the doctors stop and seriously consider it. It's a wonderful feeling." Dr. Michael heard this and felt a pang of guilt, but also gratitude. "Nurse Betty," he said, "please forgive me for all the times I didn't properly value your observations over the years." "Dr. Michael," she answered with a motherly smile, "what matters is that you changed. And that change is inspiring a new generation of doctors." Throughout the celebration, many people shared stories about how the protocol had made a difference in their practice. A nursing technician shared how comfortable they felt questioning a medical prescription that seemed incorrect, preventing a medication error. An assistant recounted how they suggested observing a patient's symptoms, leading to an important early diagnosis. "Do you know what this means?" Dr. Michael Williams said to Amanda Johnson as they watched people sharing their stories. "It means we've created a culture where competence and observation are valued regardless of hierarchy. And where mistakes are prevented because everyone feels safe to speak up," Amanda added. "Exactly. How many lives have been saved just because someone felt comfortable voicing a concern?" At the end of the party, as everyone was saying goodbye, Dr. Williams asked to speak with Amanda privately. "Amanda, there's something I never properly told you," he said. "What is it, doctor?" "On the day you saved me when I was unconscious, I heard you singing," he revealed. "It was a song my mother used to sing to me when I was a child and sick." Amanda was surprised. "I don't even remember singing. I was so nervous." "It was Mockingbird," he continued. "My mother sang that song every time I had a fever. Hearing you sing it gave me a sense of peace, like I was being cared for not just clinically, but humanely." "Dr. Williams, I've sung that song when nervous since I was a child," Amanda confessed. "I learned it from my grandmother." "Maybe it was the universe conspiring so you wouldn't just save my life, but also remind me of the essence of medicine," he reflected. "Caring for people with compassion." "Doctor, can I confess something too?" "Of course." "When I saw you on the floor that day, for a second, I hesitated. I thought of all the times I felt humiliated. But then I remembered the oath I'd take when I graduated, to never harm a patient and always act in their best interest." Dr. Williams looked at her with renewed admiration. "Amanda, you embody everything medicine should be: skilled technique and a compassionate heart. And you taught me it's never too late to change, to grow, and to become a better person," she replied. They embraced, and Dr. Williams knew he had found not just a colleague, but a true partner in the mission to make medicine more humane and collaborative. 2 years later, Mercy General Hospital had become a national benchmark for collaborative medicine. The Amanda Michael Protocol was taught in medical schools across the country, and several scientific papers had been published on its results. Amanda, now Dr. Amanda Johnson, a specialist in emergency cardiology, led the Department of Integrative Medicine. Tyler was in his 4th year of college and already participating in research on compassionate pediatric care. Dr. Williams had not only become a better surgeon, but also a mentor recognized for his ability to develop talent across the hospital team. One Friday afternoon, as they reviewed the latest semester's data, Dr. Anderson arrived with news. "Amanda, Michael, you need to hear this," he said excitedly. "I just got a call from the Department of Health. They want to implement your protocol in all public hospitals nationwide." Amanda and Dr. Williams exchanged glances, moved. "Does this mean our little revolution is becoming national policy?" Amanda asked. "Exactly," Dr. Anderson confirmed. "And they want you two to coordinate the national training." Dr. Williams shook his head in disbelief. "Amanda, do you realize what this means? Millions of patients will benefit because you had the courage to confront my arrogance that day." "Dr. Williams, it wasn't just courage. It was teamwork. It was your humility in accepting change. It was Tyler inspiring us with his determination. It was the entire team embracing a new way of working." Tyler, who had come for his weekly mentoring session, overheard the conversation. "Dr. Michael, Dr. Amanda, did you know that in my medical school class, when we studied hospital hierarchy, we used you as an example of how to turn conflict into collaboration?" "How so?" asked Dr. Michael. "The professor tells your story and asks, what would happen if every healthcare professional had Nurse Amanda's courage and Dr. Michael's humility? The answer is always, we'd have better medicine." Amanda felt tears in her eyes. Tyler, your sister Emily would be so proud to see how her story inspired changes that are saving lives across the country. I know, Tyler replied. And you know what? Yesterday, I treated a child in pediatrics who had the same symptoms as my sister did. But this time, because of your protocol, several team members contributed observations that led to a faster and more accurate diagnosis. Doctor, Michael felt a lump in his throat. Is the girl okay? She is, and she'll be fine. The surgery was a success because everyone worked together. Tyler smiled. My sister didn't suffer in vain, Dr. Michael. She inspired a change that's saving other children. In that moment, everyone understood they had created something much bigger than a medical protocol. They had created a legacy of compassion, humility, and collaboration that would continue impacting lives for generations. Dr. Michael looked at Amanda and Tyler and knew he had found not just colleagues, but a professional family united by the desire to make medicine more human. Do you know what I've learned from all this? He said. What? Amanda and Tyler asked together. That true medicine isn't in diplomas, titles, or hierarchies. It's in our ability to listen to one another, to value every contribution, and to never forget that we're all here to serve a greater purpose, caring for people with skill and love. And so what began as a moment of crisis turned into a quiet revolution that changed not just individual lives, but an entire way of practicing medicine, proving that sometimes the greatest transformations start with a simple act of courage and humility. End of story. Now tell us what you thought of this touching story and where you're watching from. Do you believe Amanda made the right decision by insisting on saving the doctor who humiliated her? Share your honest opinion in the comments. We love hearing what you think. Don't forget to like and subscribe to the channel so you don't miss other heartwarming stories.